really, how do I say, when we see certain things like that and you remember Corona, people are just wondering, what is Mpox?
Yeah, Mpox is a virus similar to, we had Corona, which was also a virus, but this is a different virus. Initially, it was called monkeypox.
Okay.
The first time it was discovered was in the 1950s during some experiments with monkeys in Denmark. Since then, we've seen infections, transmissions to humans. The first one recorded in Congo.
Okay.
That's about in 1970. So we've been having smallpox, which is also in the same family virus of with monkeypox.
Okay.
And because we've really had good vaccination campaigns for smallpox, it was eradicated. And the vaccine also covered monkeypox. At some point, it covered up to 85% of the population in Zaire, when the current Congo. So it has been endemic in Africa,
Yes.
both in Central Africa and West Africa. Endemic means it's an infection that has been there. WHO has been monitoring it.
Okay.
We've had some outbreaks before, both in Congo and also in Nigeria. But it's not until the year 2022 that we had an outbreak again in the US. Although it was not seen, it's not recent in US, because in 2003 there are cases that were reported in US. So it's an infection that has gone beyond the country where it's always been, or it's been endemic. So we've seen it in Europe, we've seen it in Middle East, we've seen it in America, South America. So, and I think the reason why we are at this stage now is because it's actually an emergency of a public health emergency of international concern, because now we are seeing Mpox in countries that have never recorded Mpox.
Okay.
Yeah.
Wow. You mentioned some scientists were doing some scientific work on monkeys.
Yeah.
So I'm wondering, how does it spread? Is it because of the scientists who did some things, or how does it just spread?
Not really. Science is evolving, and you'll find some experiments done on animals. So there are monkeys in Denmark, and that developed monkeypox, and that's where the name came from.
Okay.
It was specifically seen in these monkeys. Although they are not reservoirs, probably the reservoir for this virus is not known. It's believed probably to be squirrels or rats, but it has not been established really. But again, now, after a few years, in 1970, that's when we had the first case of human monkeypox in human, or Mpox in humans. So we saw human-to-human transmission. However, it is believed it began from animal to human transmission. Yeah. So and basically in Central Africa, West Africa, especially areas where people live in forests or close to forest, interact with animals in forest, eat bushmeat. Those are some of the likely, determined or likely exposures that humans have had, or interactions with animals. And that's how the infection came to humans. Yeah.
So it's humans who have broken boundaries and gone places where they shouldn't have, yeah? Hence the spread.
We could say so, because we've seen several viruses also originating from animals. Yeah.
Hey. Okay, may God help us. Asante sana. Kindly tell us what symptoms to look out for.
Yeah, so at the moment, what happens is that we have a case, we usually have case definitions for infections. So it's been there for a long time. We've seen the symptoms. First of all, we have two types of Mpox. They are categorized as clade 1 and clade 2. So when you look at the outbreak that was in the US from 2022 towards 2023, that was clade 2, originally seen in West Africa. So the main symptoms are body rashes. That is what we can see. However, before that, before the body rash comes, you'll have some symptoms like headache, you'll have fever, you'll have back pain, then you have lymph nodes that are going to be swollen, But very particular is basically lymph nodes. Then we have this body rash that could be similar to other diseases like chickenpox, but again, the diagnosis now comes in handy and the clinical symptoms. So it takes a while before these symptoms develop, between 5 days to 21 days. So between day 1 to day 5, that's a period we call incubation period. This is a time the virus is still, it's called the invasion. It's still invading your body cells. So by the time you see the first symptoms, it could be any time between 5 to 21 days. Yeah, but the first symptoms, of course, fever, headache, swollen lymph nodes. Those are some of the first signs before now we develop the rash. And the rash is also in stages. It will start with a small, probably just a flat rash, then grows, develops into a rash that has pus, and later on dries on and breaks off. And the infection lasts for about 2 to 4 weeks. Yeah.
Is it already in Kenya? Because I think I saw a story of a lady in Thika. I don't know if it was, I saw it somewhere. Is it, as a medical practitioner, can you confirm if it's already here?
Yeah, so far we have 2 confirmed cases in the Kenyan territory. However, it's not believed that transmission happened within Kenya. So the history is that the first one was somewhere in Taita Taveta with a travel history from Uganda. And the second one in Busia border. Again, this is a person who had traveled from the DRC. So we are seeing these infections, and we say it's actually confirmed because it's confirmed within the territories of Kenya. We have an obligation to report cases, whether they're travelers, but as long as they're within our territory, we have to report. But with that also, we've had several cases that we've had suspicion. And suspicion comes with either you are in contact with this confirmed person, or probably you have symptoms, you've traveled within the last 21 days in areas that have these outbreaks, and especially you're looking at the DRC where the transmission, community transmission is ongoing. So with such kind of individuals, you'll have suspicions. We've had several of them, but the only time we can say that with Mpox, it has to be confirmed through the laboratory.
Okay, so how does somebody prevent it? I know possibly there are vaccinations, but even before we get there, like for example in COVID, we were told wear a mask, stay how many meters away from people, wash hands. Kindly inform us.
Yeah, so transmission is prevention is broader. It depends with what type of, what mode of transmission is happening within our country. So I'll talk in general.
Okay.
You'll find countries that report animal to human transmission. So when you're talking about prevention, you want to target, to interfere with this mode of transmission from animal to human. Then there is direct and indirect transmission. And when I talk about direct transmission, would talk about contact. You come into contact with body fluids of somebody who is infected. Or it could be body fluids, or through sexual relations, or through eating probably meat from an infected person, but infected animal, but that would be from animal to human. But now direct is basically the contact bit of it from human to human. Then indirect, it could be through contamination. So you're using clothes with a person who is infected, beddings, clothing, or surfaces that are contaminated, you're touching. So prevention would involve things to do with hand hygiene. You're going to avoid sharing these clothings. If somebody is infected, you're going to, we call them personal protective equipment. If you are taking care of a person who is infected, you need to do so with personal protective equipment. And this would, in this case, would be gloves, would be mask, would be a gown, if necessary, if it's not in a hospital setting. But you have to avoid that contact with body fluid. Yeah.
Wow. And vaccinations? Yeah,
vaccinations. There are vaccinations that have been approved for use. However, it also depends with the plan the country has as far as vaccination is concerned, because the recommendation is the people who are targeted for vaccinations are people who are at high risk. Either you are high risk because you are going to be exposed, or you've been exposed. So we talk about pre-exposure and post-exposure. So those are the people who are targeted with the vaccination. So, for example, healthcare workers or laboratory personnel who deal with these specimens, those are people who are going to be exposed, and those are the people you want to target vaccination program. Yeah. So if you've established, for example, in Kenya, we are actively monitoring with transmission, human-to-human transmission within Kenya is not reported because the 2 cases are actually people who traveled in. So until we get that human-to-human transmission and there is sustenance of transmission, then we are able to really have a good plan on who are going to be targeted with the vaccination.
Okay.
Yeah. But it is there. It's been used. It's been approved as well, and it is safe. Yeah. But it also depends with what vaccine the country brings in and how the drive is supposed to be organized and coordinated.
Okay. So if somebody possibly someone is listening and saying, oh, some of the symptoms you mentioned, I have seen them through someone, or I have them. How would they have it established that they have it or not?
Yeah, so the recommendation is if you've been in contact with this person or you've seen somebody with symptoms that we've mentioned, first of all, it's to seek some medical attention. And medical attention would not necessarily mean that you'll go and get to hospital and isolated, but isolation is even recommended for people who, if I've been exposed to somebody who has this rash and I'm not so sure, it is unexplained, we cannot explain the rash that you're seeing. First of all, I have to go to isolation. And recommendation is I have to monitor myself up to 21 days because this is a period when the disease could actually now show symptoms. But now we have to confirm the person with the rash has to be tested so that we rule out, because there are other diseases or infections that would manifest this similarly to Mpox, like chickenpox or scabies, some skin conditions. Somebody still come with rashes. So you really have, as a clinician, apart from just checking or testing for Mpox, you also have to rule out these other diseases. Yeah, and that's the reason why you'll find several samples have been taken to our laboratories around to confirm, but they come out negative.
Okay.
Probably they are positive for other diseases which also are supposed to be managed. Yeah.
Okay, so are there any treatment options available if somebody is unwell?
Yeah, there are treatments that are available. It depends with how severe the disease is. And this is based with the CDC guidelines. As a country, I know we also have to adapt some sort of guidelines on treatment, so because it has to be coordinated.
Okay.
If it is less severe, because the disease is self-limiting, less severe would mean the symptoms are not as bad as probably if you have rash, the rashes are not in the mouth, are not in the eyes, because they would affect the eyes and genitals. So you'll find those are self-limiting, and you just require supportive management. Supportive management would mean rehydrations, pain management, and you're monitored, and isolation. You have to be isolated. For those that develop severe disease, and you'll find some of them, some who are at risk of severe disease would include children, pregnant women, or those who are breastfeeding, or someone whose immunity is low. We call them immunocompromised because of maybe underlying conditions. So those would end up developing severe disease. And the recommendation is we have some medications, antivirals, that are used to also treat, have been approved to treat Mpox. So there are those. I'm not so sure if it's available in the country, but available in the market.
Okay.
Yeah.
Wait. So somebody is already asking, you gave us and told us that someone needs to avoid bodily fluid, but there's someone who is asking, how can I protect myself? Hence, like for example, you say that there are certain things that we can do, wear gloves.
Yeah.
But now, most of us, I think it's only a small percentage who deal with people, like people in the medical field. But for that us, how do you protect yourself?
And it might not be practical. When I'm talk about personal protective equipment, probably the public doesn't have personal protective equipment. So actively, if you are taking care of a sick person who has these symptoms, we're talking about a person who's developed a rash that you cannot really explain, or you are in contact with somebody who's sick who's had history of travel, maybe in areas that we have this outbreak, or who has been in contact with somebody who was infected. Those are some of the things that would make you first of all, you want to try and avoid this contact with this person. At times you may not avoid because you're in the same household, or maybe a person is still in a period of incubating. We don't know if it is the disease. But again, there are measures that we need to take. And here hand hygiene comes really handy. Hand hygiene, anytime you're coming into, because for an infection to happen, we talk about there must be a portal of entry. And a portal of entry, either you have a skin break on your skin, or you've inhaled some droplets. Those are some of portal of entries. So you want to protect that.
So in public, someone can wear a mask?
You can wear a mask. However, I don't think we've reached that level, because we are not seeing sustained, probably new cases, community transmission.
Okay.
But I'm sure maybe at some point, if we reach there, maybe that would be a recommendation. But that one, we leave it to the public health. But in the event, we promote strongly hand hygiene, because you break the transmission, especially for indirect and even direct. You really have to perform your hand hygiene. If somebody has a rash, you want to avoid to come into contact with this person.
Yes.
You avoid sharing clothings or beddings, because those are some of the routes that an infection would occur or you'll be exposed to Mpox.
Okay.
Yeah.
Wow. Thank you so much. I think you're going to go for a very brief break. When we come back, I'm going to say hi to David. I can see several people saying hi to you. I think they know you. And ask questions, because several people are asking questions that only David can answer, because he's a medical practitioner here. So I'm going to give that opportunity after the news. Kindly join us so that we will have an opportunity to just answer one or two questions. If you have a question, I can already see a few. Send it on 20933. Better yet, just write in on 0717 400 555. And I know that God is going to minister to us greatly. See you in a short while.
FM. It's now 12 p.m.
Listen and live.
A revival is breaking out.
The voice of hope in the air. News on the go with Gloria Musimbi.
Good afternoon. The Kenya Union of Post-Primary Education Teachers in Kilifi County has emphasized that the strike is ongoing due to the government's failure to address their demands. They have stated that they will not be intimidated by threats from the Teachers Service Commission (TSC). The union continues to demand action from the government, and KUPPET remains resolute in its stance despite the pressure. Elsewhere, President William Ruto is set to unveil opposition leader Raila Odinga as Kenya's candidate for the African Union Commission AUC chairmanship seat in State House, Nairobi. The ceremony will be graced by at least 6 African presidents who are already in the country. Meanwhile, former Law Society of Kenya President Nelson Harvey suggests that this move to support Odinga's AUC chairmanship bid could be strategically aimed at permanently distancing him from the Kenyan political
are you?
Yeah, good to have you again. Now, there are several people who asked some questions, and we saw it fit to answer them. But before we get there, somebody is saying, Salamu kwa David, I'm Mary Mukimba. Possibly somebody you know. Scan his memory, itakuja kwako. Somebody else saying, hi Hope FM, I've seen a video that brings out suspicion regarding vaccination. It's been linked to infertility that is trying to reduce the global population. This is one Nora. Yes, kindly go on.
Yeah, sure. I've also seen such videos, and it's not surprising that we'll have this information during crises like this one. We had such during COVID, and again here, we are going into probably a crisis, yes or no, but we'll still have information that would either be true or not true.
Okay.
And this is something that is referred to as infodemics. So again, as a government, and that's a responsibility of coordinated efforts. It's usually part of a coordinated effort that governments look into and try to mitigate. So one thing that governments do, especially when we have emergencies like this one, is to protect the community through awareness. And that's why we really have to also see what kind of messages that go out there regarding illnesses or sicknesses that we are seeing, viruses. So most of these things are scientific. Mpox is not a totally new disease compared to COVID-19. COVID was a new disease.
Okay.
Mpox has been there since the 1950s or 1970s, and you've seen human transmission of Mpox. Coming back to vaccines, the vaccine is also science. We've seen vaccine protecting populations from pandemics that we've had in the past.
Polio.
And swine flu, and even recently COVID-19. So as part of response, this is a coordinated response that is done internationally. When you have illnesses, infectious illnesses like viral illnesses, you may develop immunity either by getting the disease and building your own immunity, because once you get you get a viral infection,
Yes.
your body will produce antibodies that will protect you if you're exposed to this disease in future. Another way of the body getting this immunity, you don't have to actually go through the very severe disease to get immunity. And that's why vaccines are there. So vaccines will also introduce, it could either be a live virus or some components of the virus in your body, and trigger your immune system also to basically build up some antibodies against.
Is that the reason why people, sorry to interrupt, why people sometimes get unwell after a vaccine?
Yeah, it's possible. There are those that react to vaccines.
Okay.
But when you look, by the time a vaccine is approved for use, it's really undergone research, and it has been tried. There are different levels of trials that are done before a vaccine is approved. From the laboratory with probably animals to a very small population, and they even try its safety. How safe is it?
Okay.
They look even, they weigh some of the side effects that the vaccine would have. So by the time you have an approved vaccine for a certain viral infection, it's really undergone, we would say, clinical trials that at the end of the day, it's actually considered safe for the population.
For the population.
And you'll find these vaccines, and that's why research is still part of any response, emergency response. We could be having today one vaccine or two vaccines, but you see, as you see this pandemic, this emergency growing or outbreak growing, research still continues, not just for vaccines, but also for medications that are used to treat Mpox. So it is something that is open. It is not something that can be done uncoordinated. We have the WHO, we have the CDC. These are authorities that really guide most of these investigations. And so I also want to say that I respect there are people who probably because of various reasons, wouldn't take vaccines or that. And that's why a vaccine is a medication. There's the aspect of consent. And also governments determine what is safe for its population or for the community. And some would be targeted, some would be, for example, during COVID, it was mandated that everybody gets a vaccine. Some got it, some didn't get it. But again, it's your conscience and how you perceive all these, the risk factors that you're facing. Because at the end of the day, it's about weighing health, good health, and sickness. So if you are going to be exposed again, or you are going to expose somebody else, how do you weigh these two? Today, if I'm a healthcare worker and I'm exposed to Mpox, and I'm still taking care of other patients, would my conscience allow me to do that, or would I rather like have a vaccine that is tested, so that I'm protecting myself, I'm able to continue taking care of other people, or in whatever exposure that I'm facing, either pre or post. So it's a matter of weighing what you want. But governments, authorities will always direct. For Mpox, the recommendation is people who are at risk for exposure for Mpox are strongly recommended to get the vaccine.
Is it available in Agakhan?
No, it's not available. These are usually activities that are really coordinated from the public health. These are public health concerned. So public health would own these. So at some point we may have it in Agakhan, but it will be through a coordinated effort by the public health government, because we have to make sure that it's part of the response, and the response being a public health, not just of national interest but international interest. There must be some coordination on all this. And to prevent having vaccines that are not fake vaccines. People will take advantage if such activities are not coordinated. Several people can take advantage and probably bring vaccines that are not actually for Mpox. And that's the reason I just want to emphasize that vaccinations, immunization programs are coordinated and owned by the government and directed as well.
Okay. Yeah. Off here we were talking about the way these days there are a lot of vaccinations. Actually, if you have a young baby, sometimes the vaccinations are so many. And I'm not against them. What I would want to ask you is, how can somebody build their immunity?
Yeah, we have something called active immunity and passive immunity. And most of the time, passive immunity wouldn't protect you for long if you are a baby, because it's immunity that is acquired. So because of science, we have vaccinations. And when you look at childhood illness, these children or babies are at very high risk of getting infections. Because their immunity is not well developed. However, there is also an advantage whereby a community would actually benefit from people, large population that have been vaccinated. So people who are not vaccinated actually develop immunity because a larger population has already been vaccinated. We call it herd immunity. So at times, living healthy, eating well, exercising, some of those activities would actually basically build up your immunity. But again, when it comes to exposure, immunities for individuals vary. Some would end up getting sick, depending on how your immunity is. Some would be able to fight off the infection. So it really varies.
Yes, possibly the last question that I'm going to ask is very simple. For us who believe, the Bible says, do not be anxious about anything, but in everything by prayer and supplications, make your requests known unto God, and the peace of God that surpasses all understanding will guard your hearts and minds. And
that's a famous scripture.
Yes, it is. And it's good to memorize such scriptures when anxiety comes. You can actually say it. But I know that as a medical practitioner, you have dealt with people, especially during COVID, who are very anxious.
Yes.
What is the place of, anxiety in overcoming a disease?
Yeah, so one thing I would say first is awareness. When you have information that can be trusted, that is just one way of basically dealing with your anxiety.
Okay.
However, having said that, it is part of the response of an emergency situation like this. People will be anxious, and I've talked about protecting communities as one of the functions of the response. Protecting community brings in even our colleagues, psychologists, the people who deal with the psychology or anxiety, because people worry. Today, I may be worried. Am I exposed? Have I exposed myself? And you're looking at the news, you're seeing how people are suffering, how severe this disease is, how scary it is. You can imagine the skin rash. I'm sure you've seen how some pictures about on Mpox, people who've had Mpox. So anxiety is going to be there. But again, it's coordinated centrally again, where we involve experts to be able to deal with this from the information that is being spread and getting the right people to be able to handle the anxiety.
Wow, thank you so much. Possibly if you have your final comments or something that you would like to encourage someone before we say kwaheri.
Yeah, I know these are difficult times we are living in. Sicknesses, infections are not new.
Yes.
We may continue. We will continue having these infections. Will still be there, but again, I just want to say that there is always hope. The Bible gives hope. When it talks about in the future, people will not be sick. Nobody will say that I'm sick. These are the scriptures that really encourage people. So I think comfort, apart from what we do as medics, the Bible gives a lot of comfort. Yeah. So it's high time we also focus on what hope the Bible gives, as much as we face these emergencies that are here with us for now.
Amen. I like what you said, hope, especially because we are on Hope FM anyway. But also the scriptures are very, if you don't have hope, it's easy for you to succumb, yeah? There's a verse, David, I like verses, so I say that a lot. In, I believe it's Psalm 27, it says, I would have despaired had I not believed that I would see the goodness of the Lord in the land of the living. In other words, Bible commentators say David believed he would outlive that situation.
Yeah.
So my posture is, at a Mpox, we will outlive it.
Exactly.
Yeah, because we have Jesus, we have hope.
Yeah.
Yes.
That is the hope that keeps everybody going.
Yes.
Yeah.
Asante sana. I also see somebody else. I think this is the same person, but let me look. Someone saying, salams to David Odada from Nora Madheka.
Yeah, that's my colleague.
Okay. Asante sana. God bless you so much. Have a wonderful time.
Thank you for having me.
Yes. Yeah. Karibu sana next time. Next time, we will invite you to come and answer questions.
You're welcome.
Okay, bye.
Hope FM, another quality service from Christ, is the Answer Ministry. Listen and live today, tomorrow, and every day. Recharge.
Great is thy faithfulness, Master. Great is thy faithfulness, O Lord.
Activate.
My heart was heavy this morning, but after the prayers, I felt unease.